You're watching this video because your state is participating in the National Core Indicators Staff Stability Survey. This survey will examine the stability of the workforce of direct support professionals supporting adults with intellectual and developmental disabilities in your state. This survey will ask questions about types of services provided by DSPs, their wages, benefits, and recruitment and retention strategies. These data are important because the quality and stability of the direct support professional workforce is critical to ensuring quality outcomes for individuals with intellectual and developmental disabilities in your state. My name is Dorothy Hersteiner, and I am the National Core Indicators Project Coordinator. My email is on this slide. If you have any questions, please feel free to contact me. I'll start by telling you a little bit about what this video will cover. We'll start by talking about the Staff Stability Survey and giving a brief overview of the National Core Indicators Project. We'll then go into instructions on the survey itself, and I'll finish by telling you how to enter data into the online data entry system, ODESA. What is a direct support professional? From the perspective of people with intellectual and developmental disabilities and their loved ones, direct support professionals fulfill the most important role of all within the service system in your state. The role of the DSP is to support people with intellectual and developmental disabilities to experience the quality of life they desire. In doing so, DSPs work to provide prescribed support and supervision, support people to learn new things, ensure optimal health and safety, and to help with upkeep of the person's home to assure it is clean, safe, and hazard-free. One of the most crucial roles of the DSP is to provide support and assistance for people to learn, or to continue to learn, to do as much as they can on their own. Why is your state participating in this survey, and why is this survey important? As I stated previously, DSPs play an integral role in providing supports for individuals with IDD in home and community-based settings that are integrated in the community. In addition, research has shown that the stability of the DSP workforce, for example, turnover rates or vacancy rates, are directly related to consumer outcomes. Therefore, it is critical that states begin to closely examine the stability of the DSP workforce to enhance service satisfaction and quality of life of individuals receiving services. As of yet, there is a lack of data on the DSP workforce. That is where this survey comes in. This survey will provide data on the DSP workforce, such as wages, benefits, types of services being provided, recruitment techniques being used, and retention strategies. These data will identify how the workforce itself is being supported and where challenges may lie. Please note that this survey will take the data that you provide regarding your provider agency and aggregate it at the state level. It will be presented as state averages, and your agency will not be identified in any way. However, in order to provide your state with accurate and valid data that represent the total DSP workforce in your state, it is critical that all providers respond to this survey. Here is an example on how the data will be reported. As you can see, we took the responses from each state and found the average. So the average wage per state is reported, and the wages that each individual provider reported are not shown individually. However, please keep in mind that in order to be able to report accurate numbers and accurate data, it is critical that all providers within your state participate in the survey. The data from this survey will inform and provide evidence for the need for policy and program development regarding direct support professional workforce improvement initiatives, will help to monitor and evaluate the impact of workforce initiatives, will help to states compare their workforce outcomes with those of other states, will provide context for outcomes for individuals with intellectual and developmental disabilities and their families, and will help to build systems to more effectively collect, analyze, and use direct support professional workforce data. What is National Core Indicators? In the early 90s, the National Association of State Directors of Developmental Disabilities Services, the DD directors from various states, and Human Services Research Institute sat down together to devise a way to measure state-level outcomes for people with IDDD using state services. We wanted to be able to answer questions like, how are people within state DD systems doing in terms of health, employment, choice, community inclusion, and other outcomes? In other words, we wanted to measure how DD services were affecting and influencing people's lives. We also wanted states to be able to compare state DD system performances to that of other states, and also to benchmark in order to see if performance was changing from year to year as a result of programs, policies, and initiatives. This is how the National Core Indicators project was born. For more info on National Core Indicators, please go to www.nationalcoreindicators.org. I'm going to take this opportunity to thank you in advance for your participation in this survey. Here are some simple instructions for you as you get ready to enter your responses into the online data entry system, also called the ODESA system. These instructions are also included in the online survey as well, so I will go over them briefly and you can read them on your own. This should look similar to the email you received regarding this survey. You may have accessed this video from a link in this email. This email briefly explains the survey and includes a link which is unique to your agency to access the survey on the online data entry system called ODESA. The link will look similar to the one at the bottom of this slide. When you click on this link, it will take you directly to the survey. Please do not forward this email to anyone outside of your organization. And if you access the survey, please do not write over existing responses already in the system unless you are correcting or editing responses. If you write over existing responses, those existing responses will not be recorded. Before I bring you to the online data entry system, I want to give you some specifics on the info we're trying to collect. For the purposes of this survey, when we refer to direct support professionals, or DSPs, we are referring to direct support staff who were on payroll for any length of time during the period between January 1st, 2015 to December 31st, 2015. This survey will ask questions like how long those staff members have been employed, whether they are current staff or separated staff, meaning did they leave your agency within the past year, what was their date of termination if applicable, whether they work full-time or part-time, for current staff only, their hours and wages, and the benefits they receive and that your agency offers, such as paid time off, health insurance, etc. It's probably best that the person who responds to this survey is well versed in payroll and/or HR within your organization. For the purposes of this survey, we're asking about the DSP workforce that spends at least 50% of their working time providing supports to adults age 18 and over with intellectual developmental disabilities. If your agency provides services to adults and children, please refer to staff whose primary responsibility is to provide supports to adults with IDDD age 18 and over. Please include all full-time and part-time staff if applicable. The direct support workforce includes people fulfilling jobs similar to those you see in this slide. Please note that this list is not exhaustive and other job titles may apply. To reiterate, please refer to all paid direct support staff members who spend at least 50% of their hours doing direct support tasks. These staff members may do some supervisory tasks, but please be sure that their primary job responsibility is to spend more than 50% of their hours doing direct support work. Please only include supervisors if more than 50% of their hours are spent doing direct support tasks. Please do not include licensed healthcare staff such as nurses, social workers, psychologists, etc. When answering this survey, we'd like you to consider DSPs who work in the following settings or provide the following types of services. Residential supports, supports that are provided to a person who is living outside of the family home, such as 24-hour supports in a group home or an ICFID. This can also include supported housing or supported living. If a person is in shared living, host home, or foster home, please include only those direct support professionals who are working in addition to the shared living or foster provider. Another type of support we'd like you to consider are in-home supports. These are supports provided to a person in the family home. We are also asking about non-residential supports, such as day programs and community support programs, or job or vocational services. Please do not include employees who are providing the following services: those who are hired directly by the person or the person's family for whom your agency's role is limited to that of a fiscal intermediary or employer of record. Please do not include people only working in school settings for children through 12th grade, people providing therapy services, or people providing seasonal services such as summer camp counselors. Please do not include staff members whose only role is to provide transportation. Now that you know to whom to refer when answering the questions in this survey, let me bring you to the Odessa system, the online data entry survey application, so that you can see how to enter the data. When you click the link found in the email you received about this survey, you will be brought directly to this page. This is the first page of the online data entry system for the NCI Staff Stability Survey 2015. This first page goes over the instructions, all of which we have already gone over in this video. I will show you that you can download a PDF version of the tool right here, the first hyperlink. This is useful if you'd like to collect the answers before you go into the tool to record your answers. I will let you know that you can go into the tool as many times as you like to change, edit, or add answers. When you get to this page, I encourage you to read all of the instructions and to make sure you're clear on what we're looking for and the information that we'd like you to provide. I won't go over them now as we've gone over them already in this video, but please take the time to look at them when you do the survey. This is the second page of the Staff Stability Survey in the online data entry system. On this page, we ask about the different types of supports your agency provides. The first type of support we ask about are residential supports, which are supports provided to a person who is living outside of the family home. If you answer that your agency does provide residential supports, you'll be prompted to identify what type of residential support your agency provides, be it ICF, IID support, other specialized institutional support, group homes, supported living services, or other. The survey goes on to ask about in-home supports, which are supports provided to individuals in their family home. And question 3A asks you to identify the type of in-home support that is provided. The survey goes on, then question 4, to ask about non-residential supports and services provided outside of the home. These include day programs and community support programs and/or job or vocational services. You'll notice at the bottom of this page, it is indicated that if you answered no to questions 2, 3, and 4 about the types of services provided, we ask that you do not continue with the survey. The last 3 questions on this page ask whether or not your agency provides respite services, whether your agency is public or government, private for-profit or private non-profit, and whether or not you require that potential employees undergo criminal background checks prior to being hired. On each page of this survey, you'll find at the bottom 3 buttons. One says Save and go to previous page, one says Save and go to next page, and one says Save and finish later. One of these buttons must be pressed in order to save the responses that you have indicated. The third page of this survey asks about payroll data. Question 8 asks about the total number of staff that were on your payroll as of December 31st, 2015. And this is not limited to staff providing direct support to adults with IDDD. Question 9 asks about those staff, those direct support staff, providing supports for adults with IDDD. And it asks the number of direct support staff providing supports for adults with IDDD who are on your payroll as of December 31st, 2015. The survey indicates that if you have no direct support staff on your payroll as of December 31st, 2015, please do not continue with this survey. As you can see, in question 9, I have written in 15 for demonstration purposes. We'll go down to question 10 now. This asks about tenure of those direct support staff who were employed as of December 31st, 2015. It asks how many of those employees were employed for less than 6 months, let's say 5. How many were employed between 6 and 12 months, let's say 10. And how many were employed for more than 12 months? Let's say 3. As you'll see, this number does not add up to the 15 that were indicated in question 9. So when I try to save and go on to the next page, I get an error message at the top. I'll just go and fix that. The next questions ask about the direct support staff who left your agency within the last 12 months, between January 1st, 2015 and December 31st, 2015. Again, you're asked the total number of separated staff and the length of tenure of those separated staff. Again, the numbers in question 12 must add up to the figure in question 11. We then ask whether or not your agency distinguishes between full-time and part-time positions, and if so, how do you define a full-time position? What is the minimum number of hours per week that is required to qualify as full-time? We then ask the number of employees who are considered full-time and the number of full-time positions that are vacant. For demonstration purposes, I'll put in 5 and 11 here. And you'll see that question 17 autofills with the total number of full-time direct support positions that are at your agency. Question 18 through 20 ask the same questions about part-time employees. We then ask whether or not your agency's definition of full-time and part-time has changed in the past year as a result of federal directives. I'm going to save and go on to the next page. This page asks about worker compensation and benefits. Question 22 asks about wages. We ask about the average starting salary by hour and the average hourly wage for all DSPs in those positions. Please exclude any overtime rates from your calculations. And when you are reporting these wages, please refer to the period between January 1st, 2015 and December 31st, 2015. We ask about the average starting wages and the average hourly wages for DSPs providing residential supports, in-home supports, non-residential supports and services outside the home, on-site or on-call supports if applicable, sleep rate if applicable, and then in F, we ask for the current wage across all services and settings for DSPs within your agency. Questions 23 through 30 ask about benefits that are available or offered to DSPs within your organization. Please use your agency's definition of full-time and part-time to answer these questions, and please refer to the period between January 1st, 2015 and December 31st, 2015. The first question, 23, asks about paid time off. Paid time off is defined as a bank of hours in which the employer pools sick days, vacation days, and personal days. So when an employee takes a day off, it is not necessary to choose one of those designations. If your agency provides paid time off to all direct support professionals, they can check the first box. Only full-time direct support professionals has a box, only part-time direct support professionals has a box, and no direct support professionals has a box, and then you can check the I'm not sure, don't know box. If your agency does provide paid time off, as asked in 23, we ask that you do not answer questions 24 to 26, which asks about separate designations for paid sick time, paid vacation time, or paid personal time. Question 27 asks about the availability of health insurance coverage through your agency, and 27A asks about whether or not dependents can be covered by the health insurance coverage. We then ask about dental coverage, vision coverage, and about other types of benefits your organization might offer. I'm going to save and go to next page. This page asks about worker recruitment and retention. The first question asks whether or not your agency has a pay incentive program or referral bonus program for current staff to bring in new recruits, and then we ask about the amount of the incentive. Question 32 asks about a realistic job preview. A realistic job preview provides an applicant with some information about the actual job duties, both positive and negative feedback, from the perspective of people who do the work. It's often provided to an applicant prior to making a job offer, with the hopes of helping a job applicant decide whether or not they'd like to pursue the job based on real feedback and real information about what the job entails. Question 32A asks about the format of that realistic job preview, if applicable. 33 asks whether or not DSPs get trained on and sign a code of ethics. And 33A asks whether or not the organization uses a direct support professional ladder to retain highly skilled workers in DSP roles. Specifically, whether or not individuals are encouraged to continue to provide direct support to individuals with IDDD. We then ask if you have any comments about the survey, about its administration, about the questions, about the ease of filling it out. We really do use these comments, and they're very helpful to us. So now I'm going to click Save and Finish Now, and when I do this, my survey will be recorded as completed. However, I can still go back and change and correct entries that I've made. Again, I'd like to thank you for participating in this survey. If you have any questions, please email me. My address is available on the slide you see right now. I look forward to hearing from you, and thank you for watching this video.